My name is Dr. Shah. I'm a board-certified plastic surgeon with a subspecialty board certification in hand and upper extremity surgery. I'm the chief and medical director of the Center for Hand and Upper Extremity Surgery. So cubital tunnel syndrome is essentially a pinched nerve behind the elbow. The name of the nerve that we get concerned about with this condition is called the ulnar nerve. You might notice that you have some numbness and tingling on the fourth and fifth fingers on the front side, perhaps some numbness and tingling on the back of the hand. And a lot of times that numbness and tingling will be worse if your elbow is flexed, so if you're combing your hair, talking on your cell phone, or maybe even sleeping, you wake up and your hand is entirely asleep. If cubital tunnel syndrome continues to go on and that pinched nerve stays pinched for a long period of time, you can actually start to get some wasting of the muscles and you start to lose some of the dexterity in your hand, in your ability to perform fine motor tasks. So the treatment options for cubital tunnel syndrome are really dependent on how far along the compression has gone. For early cubital tunnel syndrome, just some activity modifications could be enough to help alleviate your condition. Some physical therapy, some stretching exercises, some positioning exercises to prevent you from causing that compression to be worse. If the cubital tunnel syndrome has persisted and gone on for a longer period of time, sometimes the options are a little bit more invasive. So the most traditional and most complete option to take care of a pinched nerve is to get the pinch out, to get the nerve decompressed. That oftentimes will be done under a short surgical procedure with a little incision behind the elbow where we release the compression points and then the nerve is no longer squished. The recovery from a cubital tunnel surgery in its most basic form is pretty limited. It's pretty minimal. You'll be moving your elbow the next day after surgery. You may have a little bit of surgical soreness, but otherwise you're allowed to use your hand, you're allowed to use your elbow. You spend a couple of weeks just doing some light range of motion activities, but then after about 2 or 3 weeks, you're essentially allowed to return to all of your previous activities. If you're a patient with cubital tunnel syndrome, you may have multiple different options for providers to take care of it, as it's a pretty common condition. At the Center for Hand and Upper Extremity Surgery, we have surgeons who are specialized in the treatment of peripheral nerve conditions as their primary part of their practice. So when getting treated for cubital tunnel syndrome, you want somebody who's an expert in peripheral nerve surgery, which is why we think you should come to see us.